Hi everybody. Just want to give a quick update. So last time uploaded a video, I was having some rib pain, and the intensity of that rib pain has decreased. But it seems that the muscles that run up and down my back, uh, vertically, yeah, are the ones that are giving me a lot of grief. I think they're responsible for causing the rib pain. I think it's where the muscles connect to the ribs that's giving me problems. And it looks like, I'm guessing, that it could be due to the myositis or my autoimmune overlap mixed connective tissue disease. Um, I'm hoping that it means that the hydroxychloroquine is that it's not working. I'm hoping that maybe another month. It takes up to 3 months for that medication to do what it's supposed to do. On the plus side, at least the medication is helping my body to, be protected from the virus that's going around, the COVID-19. If you haven't looked it up yet, the hydroxychloroquine is a treatment that a lot of these places are using to help people fight off the bug. So it's an anti-malarial drug that they give to people who are exposed to malaria to help them fight off the disease. So, but apparently it's helping to fight off this one as well. Maybe not cure it or anything, but to help, the body fight off the disease. But anyway, so well, I got my scan yesterday, so I will know more by Tuesday or Wednesday, um, whether it's a cancerous tumor on the spine. It's causing pressure and causing the muscles to spasm, which by the bilateralness of it, I would guess not, but I'm not a doctor. But I'm taking guess that has to do with my autoimmune, and it's also affecting the muscles in here. It's like they feel tight, and that's what's going on. That the muscles that run up and down my spine they're just tight, and I can massage them and get relief. I'd be using a tennis ball or my knuckles, like the top part of my knuckles, and I'll dig into the muscle like that, from behind me, and it does help the muscles do, they're like guitar strings, they're so tight. So I can kind of get them to relax a little bit, enough to take the pressure off and allow somewhat normal motion. But the muscles are definitely tightening up, and I don't know exactly why. Um, I'm hoping that the scan will show something, but I hope it's not showing a tumor. That would be disappointing, but it's a possibility. That's the one thing with treating an autoimmune with myositis and cancer. It's hard to tell what's going to be causing the problem until we go do scans. And the scan that comes along with the PET scan, the CT part of it, may not be accurate enough or detailed enough to show if it's muscle or not, or if it's tumor. If it's tumor, it'll definitely show that. But if it's not tumor, it may not be detailed enough to show what's causing it. But I have a feeling that it is the myositis. But even then, I have blood work scheduled for next Wednesday as well, and that may or may not show, because not all muscle destruction or muscle damage shows high CK, or creatine kinase, I believe that's how you pronounce it. But anyway, on the whole COVID-19 thing, I went to get my scan done and at Kaiser, and it was interesting. There was very few people there, which was comforting, because being at double high risk, because I have an autoimmune and cancer, puts me at double risk. Um, it was nice to know there's not a lot of extra people. That was very, relaxing. But I was very cautious not to touch anything with my hands. And they did have hand sanitizer available, so I definitely took advantage of that. A little sore right here, little lymph node. But, just, it was nice. There was hardly anybody there, but it still made me kind of nervous, being out. And anytime when you're in a laboratory where other people go who might be sick, I was like, I don't want to go in, but I had to. Luckily, there were very few people there, and we were able to social distance very easily. At that particular location, they're actually going to be doing a major testing. This is the one, this is in California, in Elk Grove, on the Kaiser on Bighorn. And they're going to be opening that on Wednesday, so you can drive through and get tested at the Kaiser there. Yeah, I'd rather not. I hope I never need to. I've been trying to be very careful not to expose myself, you know. I think, and then I went and got my injection for my bones for the Exgiva the day before. That was Thursday. And again, very few people. I was so thankful. I went to South Sac Kaiser, and that place is usually a zoo. And it was half as busy as it usually is, which I was very grateful for. And at the front doors, they gave me a hand sanitizer and asked me if I had symptoms. And I went in, I checked in. There was nobody in the waiting room for the oncology department. However, there were 2 or 3 different people or sets of people waiting at the infusion department. And I decided I'm not going to sit over there with other people who have compromised immune systems. I'm going to sit just across the hallway, or excuse me, I didn't even sit. I stood because I didn't want to touch the chairs. And I was in and out. I got my injection and everything and paid for, well, yeah, did I pay? I remember if I had to pay for that my injection. But I was in and out in 10 minutes, and it was awesome. And I felt safe, and I felt like they'd done a good job protecting my health. So I was very grateful that Kaiser was able to, you know, do what they did to keep us being able to come in and get our treatments done. Because, you know, my doctor was concerned about me going in, and she urged me not to go in to get my injection because it isn't life critical. But I consider having, I do have, I think, 4 spinal tumors. They're not big, but they do weaken the spinal column, and I consider that kind of important to my life. If that were to fracture, I could become paralyzed or a quadriplegic, since one of them is on a C1, which is at the base of the neck here, base of the skull. If that were to break, I would probably be on ventilators, and because that kind of, that would not be, if it were to crush the spinal cord there, it would be life-ending. So I consider the shot for Exgiva to help protect me from fractures. It's not going to stop them, but it will reduce my likelihood of having a fracture. That is what it's there for. It's there for people who have weakened bones. And I've been on AIs now for 4 years, and I have no ovaries, and I've been on prednisone, and that all makes my bones weaker. So I feel that this is kind of important to keep the Exgiva going, even though it's only every 6 months. And for me, it's only every 6 months because I had, what do they call that? Where necrosis of the jaw, osteonecrosis, where I actually had a piece of bone die, and my body had to like push it out of the gums. It was a 6-month long ordeal to get that to heal. And so they feel that it was the Exgiva. Actually, the bisphosphonates are much worse. The other kind of bone medicines, they're much worse because they stick around permanently, whereas the Exgiva does get out of your system. So I'm glad that my previous doctors put me on that rather than something else that could have been much, much worse, because that jaw could have been completely destroyed. So that jaw's normal now. It's got a little bit of a smaller spot, but you know, I can handle that. Anyway, as soon as I get my results and what my doctor may do, I mean, I do have these lymph nodes here, they're not huge, but I can feel them, and they're not painful, which is weird. So that tells me that that could be the cancer. So I believe that's been there for about 6 months, and it's slowly growing. And so, it's getting a little bit harder to swallow. You know, it's not, I kind of like the muscles up in here kind of take a little while to push things down. It's like I feel like I'm fighting, but then my other doctor's saying, well, that might be GERD. I'm like, oh my God, I don't know. Hopefully the scan will shed some light on what's going on. But as soon as I know, I'll share the results with you, and hopefully you'll be able to gather some useful information from it. If you find this video helpful in any way, please feel free to share it. It helps, you know, helps other people out. That's what I'm here for. Thank you a lot. Have a good one. Stay safe and clean.